Welcome to the training for how to be an effective behavioral health advisory board and commission. I'm Teresa Comstock. I'm executive director with California Association of Local Behavioral Health Boards and Commissions. And I just want to thank you for serving on or supporting the work of one of California's 59 local behavioral health boards and commissions. We really appreciate the work that you do, and we know that it's a difficult topic. And there's a lot in law in terms of requirements, so we'll review that today. And I'll be glad to take questions as we go along. If we get bogged down in questions, then I'll just move through the materials, but want to be open to any questions you have, whether we get through your questions today or if you want to follow up by email or phone call. I'm always glad to connect with you directly. All right, so let's get started. I'm just checking the chat. I want to make sure I'm not missing anything. Okay. Since I'm sharing my screen, if there's any technical difficulties, if somebody could come off mute and let me know. It's a little hard for me to monitor everything at once. Okay, so we're going to talk about membership requirements, meeting rules and conduct, duties and tools, the Behavioral Health Services Act, and the role of the boards and commissions in particular, and then how to review and evaluate. And through all of this, I want you to remember that you're experts in your own experience. So we want people to be respectful of everybody that's on the board, and doesn't matter what area your focus is or your background is. We want to make sure that everybody is respected and listened to. So the first item for membership is 3-year terms. Members are appointed by the governing body. Usually that's the Board of Supervisors for 3-year terms. There should be a 10-member minimum or 5 members if it's a county with a population of 80,000 or fewer. 50% of the members should be either consumers, which means individuals with lived experience or individuals who have received services in the past or are currently receiving services either for mental health or substance use. Or they're family members of consumers. So that 50% is made up of consumers or family members. And within that, at least 20% must be consumers and 20% must be family members. And also one of those 50% must be an individual 25 years of age or younger. You could have more than 50% consumers, and oftentimes there's an overlap with the other categories that I'm going to review with you. So it could be one person that can meet multiple criteria requirements. There should be one Board of Supervisor member, one employee from a local education agency, one veteran or veteran advocate, and veteran advocate's very loosely defined. It could be just a family member of a veteran. You should reflect the diversity of the local client population as much as possible. And then it's encouraged that you have individuals with experience and knowledge of the mental health system. So in sectors that intersect with behavioral health, like county offices of education, hospitals, hospital districts, a number of different intersecting areas, including law enforcement. And then there's, I'm sure, many, many other sectors that need to be represented within this. And then there are some exceptions. So individuals usually cannot be serving on your board or commission if they are a contractor or an employee of either the Behavioral Health Agency, the California Department of Healthcare Services, or a contractor of agency. But there's exceptions to that. So if a person is a consumer, if they've had lived experience and they're not in a role where they're overseeing contracts or fiscal financial matters, then it's okay for them to serve. So it wouldn't be like an executive director of a nonprofit that contracts with the county. That wouldn't work, but it could be an employee of that nonprofit if they're a consumer. And it could be an employee of the behavioral health agency as long as they're not overseeing contracts or they're not directing the financial matters as well. All right, so I'm going to switch over to the Brown Act guide and talk about open meeting rules. And then after that, we'll go into what the duties are of the boards and commissions. So I'm going to pull up a different presentation here. The Brown Act is California's open meeting law for local agencies and boards and commissions. And uh, it was just updated January 1st, and they've put into effect some new allowances and changes to the law that are good for 5 years. And this is what they've done in the past when they've made updates is they'll give it a sunset date and then usually you'll see things put back or they allow them to continue or they adjust them. So the topics we're going to review are Brown Act basics, which are what are open and public meetings, who is covered and not covered, documents, handling documents that are viewed by a majority of your board or commission, posting requirements for agendas, public participation requirements, and then teleconferencing. And we'll talk about teleconferencing in terms of what's been in place and is in place and has been in place for a long time. And then we'll talk about a few different alternative ways to do teleconferencing. That area is kind of confusing right now because it looks like the state's making some changes to allow more teleconferencing, but as they do that, there are some growing pains. And then voting, we'll talk about voting. Whoops. And then so we'll end with some frequently asked questions. So meetings of public bodies must be open in public. Okay, so a meeting itself has a very broad description. It's any gathering at all. It doesn't have to be a gathering in a room. Any gathering of a majority of the members, which in California law they call that a quorum. If it's a majority, it's more than half, then it's a majority of members. And that's a meeting can be of a majority of members of your board or commission or of a standing committee. And a standing committee is basically a group, a smaller subset of your members that meet regularly. Then they're called a standing committee if it's a regular meeting. And that's to hear, discuss, or deliberate on behavioral health issues within your local jurisdiction, your county usually. So emails, text calls, or any other contact that would result in a quorum is a violation of the Brown Act. So they're considered a meeting if you've come together, even if it's through emails or through chat. Or through social media. We want you to avoid discussing the topic of behavioral health with a quorum of your members outside of a posted meeting. Who is covered by the Brown Act? Public bodies are covered of local agencies. In law, you're called a legislative body. Your boards and commissions are legislative bodies and you are advisory bodies. And it's important to note that you're advisory bodies because there's more allowances in the Brown Act, which we'll get into in terms of teleconferencing. And then the standing committees, like I mentioned, are also covered by the Brown Act. Who is not covered? Ad hoc advisory committees or work groups. So if you have a few members that come together just to work on something, maybe they're working on putting together an annual report, or they're trying to go more into research into a certain topic that the board is interested in. It's okay for them to do that as long as it's short term and it's less than a quorum. And it's okay for members to call each other between meetings. You could have members talk to each other as long as, it's just kind of one-on-one conversations are just fine. People can get together for coffee, they can meet, they can get on to teleconferences, they can talk by phone. As long as it's just individual contacts and it's not an ongoing regular meeting. We don't want it to become a regular meeting because once it becomes a regular meeting, even if it's two members that are meeting regularly, then it becomes a standing committee. Who's not covered by the Brown Act? Also, most nonprofit organizations. My own organization, CalBHBC, we're an association that is a nonprofit. We're not covered by the Brown Act. And then state government agencies have different open meeting laws. It's called Bagley-Keene Open Meeting Act. All right, so for documents, you should treat any document that's shared with the majority of the board within the subject matter of local behavioral health. That should be treated as a public document. So it should be shared without delay with the public. Usually best practices is if there's been a document shared among members, among a majority of members between meetings, say it's been emailed to all the members, just attach that to the agenda packet for your next meeting, and maybe post it on the website with the packet. So agendas must be posted on the agency website and at physical meeting locations, freely accessible to members of the public. So we want them to be able to see them if they go to the website or if they come up to the building where they're physically located. And they should be posted 72 hours in advance of regular meetings, 24 hours in advance of special meetings. A special meeting is a meeting that's outside of the normal calendar. It's a different day of the month than usual, or it's in a different location. And then local media should be noted. If local media is asked to be notified about your meetings, they need to be notified about the special meetings as well. Agendas must include the opportunity for the public to address the board or commission on any item of interest within your subject matter jurisdiction. So within behavioral health for your local community. And then items must be on the posted agenda if you're going to talk about them. So that's your members. The public, they can bring up other topics, but for your members, they must stay on the agenda. So they should not be responding to the public if they're bringing up new topics. They can make notes and consider it for a future agenda, but they cannot talk about items that are not on the posted agenda. Public participation, public comment is required by the Brown Act either before or during agenda items, not after agenda items. It's okay to have it after the agenda items, but it must be also provided before or during. In some counties, especially large counties, we see all public comment at the beginning of the meeting. And sometimes counties have just general public comment on items not on the agenda at the beginning of the meeting, so that public can add those items, that aren't already on the agenda, but then they have an opportunity later in the agenda. So for each agenda item, that board or commission will allow the public to have a public comment period. Recording is okay as long as it's not disrupting the meeting. Removal of individuals is okay. Now, more wording has been put into the Brown Act in order to remove people that are disruptive. The chair must let the individual know that they must cease their disruptive behavior. So they have to give them a warning, and then they may be removed. In practical sense, it's difficult to do this, but this is, part of the law, so it's okay if you're having some disruptions to clear the room and have those individuals not be able to come back in. Sign in or identification is not required. In some counties, I see sign-in sheets and want to just remind everybody that it's okay if they sign in, but it's not okay to require it. And on the sheet itself, it should be noted that it's optional. Make sure people know that it's not required to give their name. And that's the same thing for public comment. People can do that anonymously. Translation, for individuals that have a translator, if they're giving public comment, they should be given twice as much time to do public comment. For teleconferencing, now I'm talking about teleconferencing now that's been in place for a number of years and it continues. So for members that want to participate by teleconference at a regular meeting or a special meeting or a committee meeting, um, they must post the agenda at their teleconference location. So say they're on vacation at a hotel, they need to post that agenda outside of their hotel room 72 hours in advance if it's a regular meeting. And they need to make that location accessible to people. Um, and they need to have that on the agenda itself. So the agenda has, what the main address is for the meeting, the main physical location. But if there's any members attending by teleconferencing within this part of the law, and I'll get into allowances later that will keep us from having to put our address on the agenda. But this is the standard teleconferencing practice where your address must be on the agenda. In practice, usually counties that are large land masses, they might have two teleconferencing locations in the county where they have physical locations where they're allowing teleconferencing. So those will be posted on the agenda. That's more practical for most people, although I do know of instances where during the pandemic, sometimes members would allow others to teleconference from, say, maybe their front yard, just to open it up to the public for those that wanted to come physically. Teleconference locations must be accessible to the public. So they must be able to view the meeting, and they should be able to make public comment. At least a quorum of the members should be in locations within the county or jurisdiction. The agenda must provide an opportunity for members of the public to address the body at each teleconference location. And then members with disabilities, temporary or permanent, So for teleconferencing, any type of teleconferencing at all, this type that we're talking about or alternative, it's okay for members with disabilities to attend by teleconference if it's because of their disability, and their remote participation shall be treated as in-person attendance. So it will count toward the quorum in the room. So keep this in mind as we talk about the alternative teleconferencing. Any member with disabilities, temporary or permanent, is counted toward in-person quorum requirements. All right, voting. I put this here because in-person voting and teleconference voting, they both require everything to be open and public, no secret ballots, even if you're just voting on your officers for the next year. There should be a public record of all member votes. So that's if they vote yes, if they vote no, or if they abstain, which means abstentions is when they don't vote on something. Um, and so that public record should be in the minutes of the meeting. So that should reflect how each member voted. Teleconference votes must be by roll call. Okay, so here's alternative teleconference rules for eligible subsidiary bodies. So eligible subsidiary bodies refers to a number of different types of boards and commissions, and advisory boards fall into that category. And you all are advisory board members. So this applies to you. So in this, if this is enacted, then local board and commission members can participate remotely without disclosing their physical location. There's a lot of requirements around it. First, the Board of Supervisors must approve this every 6 months. And then following that, your own board must approve it. The second is there should be one physical meeting location. There don't have to be any members there, but there does have to be one staff member at least, and the staff member must be either from the local behavioral health agency or from the governing body or board of supervisors. Um, and then public participation must be facilitated, allowing the public to remotely hear and visually observe the meeting. And of course, they can come in person to the physical location. Number 5, there should be a disclosure. So those that are attending remotely that are members, they should disclose that if there is anybody in the room with them that's 18 years of age or older. And then number 6, members must appear on camera. There are exceptions to this due to disability or technical difficulties that could be remedied by turning off the camera. So oftentimes if your bandwidth is low, then if you turn your camera off, then your voice can get through. But when members have this issue, they should notify the group, maybe put it in the chat or just notify them verbally if they can before they turn off their camera. And then elected officials, they have more rules, so they can't do the eligible subsidiary body teleconferencing. They're not part of that group since they're elected officials. Even if they're serving on your board or commission, they have more rules around being at a posted meeting. So their physical address will need to be posted wherever they are. So they have different requirements. Okay. For states of emergency, when there is a state or local emergency, then the your board or commission may meet by teleconference. So this has changed from the past for those who um, have been through states of emergency, which there have been many. Um, it used to be that the state had to call it an emergency. Now it can be called an emergency locally. And if it is, then there's a requirement that your board or commission votes to approve meeting by teleconference. And you can meet by teleconference in order to vote by majority vote. Um, and then once that happens, then the group can meet by teleconference, um, and they can um, vote every 45 days to keep this going. Okay, so I talked about a couple of alternative teleconferencing, the emergency, state of emergency, and then the eligible subsidiary bodies. And if the Board of Supervisors does not decide that they want to allow you, or maybe they just haven't voted on it yet, they have to allow the alternative teleconferencing every 6 months. For this slide that I went through before, if they haven't done that, there's still another way to do teleconferencing without posting your address. And it's through what's called just cause allowances. And this is something that's been changed a little bit we've had this over the last few years, this ability where members they could, if they had a just cause or an emergency circumstance in their life, such as an illness or a family member with an illness, um, they could attend up to 2 meetings per year. Um, Remotely without posting their address. It used to be that the board had to vote on it. The board does not have to vote on it anymore, but there does need to be a quorum at a singular physical location in order to allow this. The members should request at the earliest opportunity possible to attend by teleconference, hopefully before the meeting, but it's still okay if the meeting has started at just the beginning of the meeting for that member to request. And then they should give a description of why they're participating remotely. The next slide I'll review the items that are just cause allowances that they could use for their circumstances. The member should attend remotely by both audio and visual. Meeting minutes should include the reason they relied upon to participate remotely, and then limits to remote participation are 2 meetings per year if regular meetings occur once per month or less. You can go up if you've got several different committees maybe meeting in the same month that that member is part of. It could be 5 meetings per year if regular meetings occur twice per month. And then in the definition of calculating the number of meetings, if the meetings occur on the same day, all those meetings can add up to just one. Okay, so if it's on the same calendar date and there's 2 meetings, like maybe it's the full commission meeting and there's a standing committee meeting that same day, and that individual missed both of those, then it's only considered one meeting that they missed. And these are the items that are allowed for just cause, childcare or caregiving need of a family member, contagious illness, um, a need related to physical or mental condition that's not considered a disability allowance, official travel, immunocompromised family member, that requires the member to participate remotely, physical or family, medical emergency, and then military service obligations. All right, so we'll go to frequently asked questions. Um, the first is it okay to have closed meetings? Usually, no. There's usually very little reason to have a closed meeting for an advisory board. But there are some, sometimes there are reasons if there's something related to litigation that you need to know about or some type of personnel matter. So we have more information in our Brown Act guide that can provide more on that. But I don't know that I've ever heard of a board or commission that had to do a closed meeting. Conference attendance is okay. It's okay to have a quorum of your members. It's not considered a meeting of your board or commission if another group has called the meeting. Like today, I called this training, and there could be maybe a county that has a quorum of their members in attendance, and that's okay because they're not discussing or deliberating about behavioral health in their county today. They're at my event. If there is a group that goes to a conference from your board or commission, it's best if it's an in-person event, it's best to sit at different tables, sit apart from each other, just so there's no likelihood that you would be discussing behavioral health. Um, when you have a lack of a quorum, it's still okay to go forward with your meetings. In some counties, the county council or the board of supervisors asks you not to have meetings if you don't have a quorum. But in California law, it's okay to move forward with your meeting. It should continue to abide by the Brown Act if it's a regular meeting or a standing committee or a special meeting, because it's been posted. Speakers are going to be there. The public will be there. You want to just honor that, and if it is a regular meeting, it does need to abide by the Brown Act anyway. Retreats. Um, I'm often asked, is it okay for boards and commissions to have retreats without posting the agendas? No, it's not okay. It's still a meeting. The quorums come together, and so the retreats are subject to the Brown Act. And then serial meetings, members that use individual contacts to collectively decide an issue. That's a violation of the Brown Act. So that's something I touched on already was emails and texts and chats. Even if it's somebody outside of your commission that's doing kind of a spoken wheel where they're talking to every single board member and trying to get them to maybe vote a certain way on an issue, that would be a violation of the Brown Act. So you need to avoid that. All right, any questions on the Brown Act before I move back to the duties?
Yes, I have one. This is Mark McCormick from Calveras. I'm just double checking. It sounds like um, we have to go with the county council because we talked with the county council and they're strict on if there's not a quorum. In fact, if we have a quorum and somebody leaves the meeting partway through, according to our county council, we're supposed to um, uh, disband the meeting. But I appreciate what you're saying, and I'm going to bring that up with the county council if possible,
Okay.
and just let them know about this and see if they'll loosen up on it.
Okay. All right. Yeah, that's fair enough. Any other questions?
Um, I did have one more. I'm just
Okay.
checking. If there's not a quorum, um, I'm forgetting my question. I will, maybe I can ask the question later because it already
That's
went
okay.
past me.
All right.
Hey there. I had posted a question in the comments section. If you could check that out, please.
Okay.
I did have one. I remembered oh, are you going through this one? Sorry.
Let me go ahead with these. So in the event of a special meeting in VC, is that Ventura County?
Yep. Yep, Ventura
Okay.
County.
What local media outlets would provide the notification to the public? So the there's not a requirement for local media to post. It's actually the county website, your staff needs to post on the county website. And if the local media has asked the staff to notify them of meetings, then they must provide that information to the local media.
So,
So,
so that slide was a little bit, the comment on the slide, just for future reference, it's a little confusing. No, not this slide, previous one, where it specifically states that, go back, one forward, forward. It says the third bullet, plus notification of local media. So I'm thinking if there's a special meeting, if it's just the website, like I guess media, I don't think of the website as media, but it is. But is that it? Or is there like
no,
an
yeah,
Instagram
I
or
added some words to the slide. So the slide doesn't say if media has asked, but this is notification if the media has asked for that information.
when you say media, do you mean like a news channel or I don't know. I think it's kind of throwing me off. Like
Can be a news channel or a newspaper.
so in
That
the
sort of
is
thing.
that for like when the Brown Act, like the concept here, is this because something's going on in the community, it's getting public attention, there needs to be a special meeting and media, like public media is involved. And so there needs to be 24-hour notice and publication in the media.
There's not a requirement for the agency to publicize this at all, other than their posting requirements. And if the local media, most counties have about 40 or more boards or commissions. Some of them have over 100. So the media is not interested in all of them. But some media will be interested in the Behavioral Health Board. And if they've notified staff, then what usually I see is the boards and commissions, their administrative liaison will send out a message to everybody on their list who's wanted that communication. And the local media is probably on the list too.
I see. All right, thank you for clarifying.
Okay. And then we had another question.
Yeah, Mark again.
Yeah.
So my question is, so a member is in a separate location and we're having a meeting in the county at the location that we usually have it. That person in the other uh, area location, if it's out of county, they cannot be counted as part of the quorum. Or even if they're at home, for example, they can't. What I was hearing was that they can't be part of the quorum if they're a member. Is that right?
So are you saying that they live outside the county?
No.
Oh, no.
If
Okay. I'm
let's
sorry.
say they're on vacation or
Yeah.
they're at home with a
Okay.
sick relative or something, what I was reading, what I was hearing was that they can't be counted for the quorum And if we don't have a quorum, then we don't have a meeting anyway. So I'm just double checking that.
Right. So you can't vote. You could still continue with your meeting, but unless you're in Mendocino County, so you can't.
No, Calaveras.
Calaveras, sorry. All right. So I think I'm on the wrong slide here. Okay. So there needs to be for this, there's a few different alternatives that I've talked about.
Yeah.
For this one, for a just cause, in order to allow that, so that member wouldn't have to put their address on the agenda, but there would have to be a quorum at a physical location.
Okay. Thank you.
Sure.
I have a question too. Can you
Okay.
hear?
Yeah.
I'm Marguerite Storybaker from Humboldt County, and in our county, this is back to membership. My question, in our county, quite often we have vacancies on our board, and we try to fill them as soon as we can. And the chairperson, is asking us for things that suggestions and etc. However, there's no prohibition, is there, about continuing to meet when we have some of those essential roles not filled yet, or is there?
You need to try to fill those roles as soon as possible so that the board meets state requirements. We don't have like an oversight body that looks at this, but the behavioral health director has to sign off on contracts and agreements with the state that say that they consult with the behavioral health board or commission. And that means that it must meet those requirements. It's not defined as a behavioral health board or commission if it's not meeting the membership requirements. So you're putting them, in a bad position if they want to be able to, get the funding that they need.
Okay, so like sometimes it takes a month or more to find somebody and sometimes we have two
Right.
vacancies or something, but so you're saying as long as there's a good faith effort to get someone to fill those required
Right.
things, then that's okay.
Right.
Okay.
Yeah. It seems to be so far. I haven't seen like any kind of welfare and institution code policing going on, but very important to do that. You want to make sure that your behavioral health director has faith, that they're actually signing off on something that, if you're you need to really fill those positions in order to allow that to happen. Yeah. Allie?
Thank you.
I apologize. I missed the beginning of Margaret's question. Did she ask if they didn't have full representation or if they were missing particular, like they don't have a veteran or they don't have a TAY? That's what you were saying?
Yes, I was referring to
Okay.
maybe we don't have a veteran, maybe we don't have a TAY right now, but then we're looking for it or something like that.
Yeah,
Right.
we experienced the same thing. And so that's really good to hear that and I'm trying to encourage us to fill those positions, but sometimes, yeah, the position might already be filled by somebody else and then you don't have somebody. So that is, yeah, an issue as well. Thank you for sharing that.
And then there was a question in the chat. It says Shasta County has a stakeholder who shows up to our meetings and their approach is aggressive and hostile. May I tell her that approach doesn't work? Is this TJ, are you the chair?
No, I'm not.
Oh, okay.
I am not the chair.
Okay. Yeah, it's more the role of the chair, but what I would do is if this is an individual that continues to show up like this, we do a training for chairs usually and talk about it during that meeting where if there's somebody that you can talk to between meetings, give them a lot of time. And usually the chair is the right person because, you know, they're the ones that are leading the commission. For them to reach out between meetings, listen to that person, have, you know, listen. Sometimes it might take an hour on the phone just to hear what these issues are. Sometimes that can reduce the problem so that they're not doing that during your meetings and disrupting things. If it becomes an issue where this person is disrupting the meeting or making it feel unsafe, then there could be actions taken in order to stop them from attending.
Thank you so much.
Sure. And then there's a question, is quorum a majority of the members serving or majority of members on the board? So
Could you
it's
leave that
the
light on?
current
It's-
membership.
My
It's
screen is
those that
better
are,
with that light on. Thanks.
somebody's mic is on. It's the current membership. It's who's actually on the board at that particular time, not what the slots are. Okay. Looks like. All right, so we're going to move on. I think I've gotten through all the Brown Act questions. All right, so let me go back to that other presentation and we'll go through the duties. Oh, we're going to start with conduct before we go to duties. So certainly conduct yourselves in a way that is within the Brown Act. But this list here is a list of recommended conduct that we've gotten from other boards and commissions. These are ways that help the group work together and treat themselves and the public and staff with dignity and respect. The first is active listening, and we mean listen, listen, listen. We don't mean listen and figure out what you're going to say next or how you're going to respond or react to somebody else's what they've said. Once you start reacting or responding, you've stopped listening. So we want you to listen and know that you will be able to respond in the future, maybe take notes. If you don't agree with something, listen even harder. Even if you do agree with something, you don't always have to respond to it at that moment. We just want you to be listening to each other, to the public, to the staff, to contractors, to advocates. And we'll talk about some of the tools to use in order to respond, but we want you to have considered response, not response that's reactionary in the moment. We want you to listen, and we want you to be able to get through your meetings. Number two, focus on issues. And when I talk about issues, I mean issues related to behavioral health. Look for challenges, gaps, barriers. Look for successes also. Look for things that you can make recommendations on. So when I say issues, I'm talking about something that you can really hone in on, as opposed to what I would call like a big problem, like homelessness. That's a big problem. We have to look, we have to hone in on areas where we can make changes in order to reduce homelessness among people that have behavioral health issues. So in that case, you could be looking at, how can we increase supported housing? Or if we need more board and cares 24/7 support for individuals with significant behavioral health needs. And look for information about that, have research meetings, be able to do things outside of the meeting. But during the meeting itself, we want you to be thinking about these things. Focus on issues. Number 3, person first language. We need to acknowledge that people have a lot of aspects to themselves. Sometimes they do have significant mental health or substance use challenges, but that's one aspect. So we say a person with mental illness, or a person with substance use conditions, or people with mental illness, or people with schizophrenia, and recognize that there's a lot of other things to that person, but the one that we're considering right now, within your border commission is the one that is related to behavioral health. Number 4 is no swearing, if possible. Some people swear, and some people are brought up swearing. So just try not to swear. Number 5, no personal attacks or criticism. Again, look at number 1 and number 2, active listening and focus on issues. Don't get personal with people, even if they get personal with you, even if they go after you and attack you personally. You need to focus on active listening and focus on issues. Try to stay silent when things are getting off the right path. Number 6, one person speaks at a time, no sidebars, not even whispering next with your neighbor. That's very distracting. And oftentimes when we have public comment, especially public comment, or comment by other board members that we don't agree with, I see people like looking at their phone, or they're checking out. You can tell that they're not listening anymore. So we want to make sure that you're not that you are treating people with dignity and respect. Number 7, keep comments short. If possible, do not monopolize. Number 8, limit acronyms. Always spell things out. And a lot of things need to be defined as well. There's so many acronyms in behavioral health. It's a new language for any new member coming on board. And we need to just be cognizant of that. And if you have a speaker that's speaking to the group that's using a lot of acronyms, it's fine to raise your hand and just ask what they are. And then silence cell phones if possible. Okay, so we're going to start looking at the duties. These are in California law. It's Welfare and Institution Code 5604.2, and there are 8 different duties. The first one is to review and evaluate the community's public behavioral health needs, services, facilities, and special problems in any facility in your county. So keep in mind that's the public behavioral health needs. So within the public system. And we have a listing of some tools that we recommend here. Of course, many of you probably are used to having speakers at your meetings. Usually the behavioral health director and staff will speak to you. We also recommend having panels of speakers if you've identified a topic that you want to learn more about, and you know that it intersects with different sectors. So bring in people from different areas that can speak to an issue, and it's good to break down silos that way. And also there's less finger pointing. You know, different agencies, if they're all at the table together, then they look more for solutions. Number 2 is liaisons. Have liaisons with other commissions and committees in your community so that your own members can attend their meetings and bring back information, or they could also share information from your board or commission. Number 3 is site visits. And we have some guides for doing site visits that can be helpful if you're in a county that hasn't been doing site visits. We have information on just procedures for getting them set up, and even an observation form, a sample form that you could use. Number 4 is ad hoc committees, and that's small work groups. And then 5 is performance outcome data. And we'll talk more about that. Duty number 2 is review any county agreement entered into pursuant to Section 5650. And you don't need to go and look at Section 5650. California law points to other California law, and this one points to an agreement that your behavioral health director makes with the state in order to receive funding and provide programs. And some of that is related to state and federal grant money. In order to review, so there are lots of county agreements that are related to that funding. Your county is going to be contracting with different local contractors or statewide, or even sometimes out-of-state contractors. Those agreements you can look at, things that that your county has put into contracts. On strategy number 2 and 3 is where we have some recommendations on just when to review. If there's a new major contract that the county is considering, your board and commission, you could have maybe a couple of your members, less than a quorum, that could review some of the proposals, and then also be part of the interview panel if there's an interview panel put into place in order to determine who would be the best contractor. And then with site visits, review the specific contract prior to the visit. We recommend that you look particularly at the deliverables in the contract. What's the contractor supposed to be providing within that agreement? And that's good to have before you go on a site visit. And then I went to 2 and 3 and didn't talk about 1 yet. So staff presentations and reports on some of the reports and the applications that the agency has to provide to the state in order to receive different funding. So Medi-Cal, there's what's called an EQRO report. It's External Quality Review Organization report. And these are reports that come out of annual audits. So there's an outside agency that the state contracts with that comes and takes a look at a lot of the different things within your behavioral health, your mental health plans, and your organized drug delivery systems. And they have a lot of recommendations that they will provide within their report, and then also performance improvement plans. So those 2 sections, these are large reports. So we say, take a look at those 2 sections in the report in order to learn more and have your staff also provide updates and information, because oftentimes the staff, either they've already solved the issues that are within those reports, or they may not agree with them, but it's good to get their take, but it's also good to see what's in the actual report itself. With the Behavioral Health Services Act, integrated plans and updates, There will be more and more performance outcome data, which is helpful. And those are, definitely those plans are robust documents that show a lot of the different activities that are taking place. And then SAMHSA also has grants. All right, so our next duty is to advise the Board of Supervisors and the local behavioral health director regarding any aspect of the local behavioral health program. So Board of Supervisors and local behavioral health director, that's who you advise. With the Board of Supervisors, what we've seen usually, the best practice is to advise through your annual report. So any recommendations or any needs that you've seen in your community, that's the place to provide that information. You could do it in the document and then ask also if you could provide that annual report verbally. Some counties will let you. Usually they'll give you maybe 10 minutes on their agenda during one of their meetings. Most of your recommendations really should be pointed toward the behavioral health director. They would be the ones that the Board of Supervisors would go to if they saw any recommendations as well. So, be making recommendations to them. And we'll talk about that more in terms of what their response needs to be. There are some requirements in law for them to respond to you if you've made a substantive recommendation, which is a recommendation of a majority of your board members that are in attendance at a meeting. Okay. So we break down how to advise in terms of one, identify. So listen, listen to the public, listen to your board members, listen to staff and contractors and advocates. Look at performance outcome data. Listen to presentations and have those liaisons with other boards and commissions and committees. Once you've identified something that's really become something that your board thinks is a priority item for that year, that you want to make a recommendation on, start doing some research. And tools that we recommend for that would be having ad hoc committees. That could be 2 or more members that have a short-term goal, to research this topic and possibly come up with a recommendation. Or sometimes they could come up with an issue brief on the topic. And then they should also work through the chair. The chair should be that contact with staff. They could ask the behavioral health director who would be the right staff members for this group to work with, or could you have a staff member provide information on this topic to us if there's maybe some reports or data that they could share, that kind of information. And then also you could do research through site visits to better understand specific types of facilities related to that topic. And then once identified, once researched, then we recommend drafting recommendations. And we have actually some specific procedures in order to draft recommendations, just to make it a good process. Maybe have that ad hoc draft a recommendation, have the executive committee review it, maybe make some changes, and then bring it to the full board or commission and vote on the recommendations. Okay. Duty number 4 is review and approve the procedures used to ensure citizen and professional involvement at all stages of the planning process. So you want to ensure that there are procedures in place that provide that opportunity for stakeholders to be involved in the planning processes. I'm going to switch over to another presentation here as well, because I want you to see all the stakeholders that are required. And it's the staff that does the heavy lifting here, but we want you to be part of, seeing what are they doing, getting updates from staff on how they're approaching all the different stakeholders that they're required to approach. So we have another presentation called Community Planning, which I'll pull up. Just briefly, we want to raise up some of the principles of the Behavioral Health Services Act. And these are part of what needs to be thought about as there's planning for the integrated plans. The first is to promote concepts key to recovery. And then secondly, promote consumer-operated services. Third, reflect cultural, ethnic, and racial diversity of the consumers by addressing inequities in behavioral health service delivery. And then 4, plan for each consumer's individual's needs. The agency can use up to 5% of their Behavioral Health Services Act revenue in order to facilitate the planning process. There are also staff requirements around cultural competence plans, and the plans require a commitment to cultural competence. Number 2 is an assessment of service needs, and there's a lot of information now as we move into the Behavioral Health Services Act integrated plans, a lot of information to inform needs assessments. 3, strategies and efforts to reduce racial, ethnic, cultural, and linguistic mental health disparities. Number 4, client and family member community committee. So there should be a lot of counties call it their cultural committee or cultural competence committee. They have different names, but there must be a committee. And then culturally competent training activities. And keep in mind as I go through these, this is the staff's requirements in order to do this. There should be a commitment to growing a multicultural workforce, language capacity, and adaptation of services. Now, this slide right here, it reflects what's currently federal requirements. Although I know the current federal administration has, they have put out executive orders that are probably not in alignment with this in terms of just the term itself, cultural competence, and efforts to address any kind of disparities. There's some federal pushback on this, but it has not changed in terms of the requirements through the Health and Human Services Agency. The behavioral health director has a requirement to consult with your advisory board. So we see this also as part of community planning. that your board itself exists in order to be there to consult with. And that's for the provision of services, establishment of facilities, contracting for services and facilities, and other matters in order to accomplish the behavioral health services needed. Okay. I mentioned, so I took you out of my other duties presentation just because of all of the stakeholder requirements here and the planning requirements. There are 29 different stakeholder categories that must provide meaningful involvement throughout the planning processes. So it's important that your board or commission be there in order to receive information from staff telling you how they're going to do this, how it's going, give you updates, get your advice too. You know, if you are meeting the membership requirements that you have in law, then you probably have members on your board or commission that could provide information to the staff to help them have that meaningful stakeholder involvement. We know different groups will engage in planning efforts and inform the system in different ways. Some people are happy to come to one big meeting and provide input. Other people are not. Some people will need individual conversations or really small listening sessions that are led by a community group that they trust. So we have recommendations to staff to have listening sessions and to use other types of tools, especially for unserved and underserved groups. This slide shows the tools for community planning that were listed by Department of Healthcare Services in their policy guidance. Many, many different tools that could be used. They do require education and engagement to support meaningful involvement. They recommend listening sessions also. We put here our own example of a toolkit for listening sessions. We have a link to our website. Conference calls, client advisory meetings, consumer and family group meetings, town hall meetings, video conferences, media announcements, targeted outreach, public comment, which would probably be public comment at your own meetings, and public hearings that could be during your own meetings. Stakeholder work groups and committees, focus groups, surveys, key informant interviews, and then training, education, and outreach, and more other strategies are listed. Okay. All right. So I'm going to move on to the next. I'm going to go back to our last presentation, go back to the duties and finish those off. All right, the next item is submit an annual report to the Board of Supervisors on the needs and performance of the county's behavioral health system. So we underline needs and performance to make sure that's where your focus is. And I would recommend on the very first page to write either an executive summary or a letter from the chair of your board or commission to the Board of Supervisors that lists what are the needs and performance. And that could be in the form of what were the recommendations you made this year and why, and what are recommendations you're working on, what areas are you looking into in the coming year. Duty number 6 is review and make recommendations on applicants for the appointment of a local behavioral health director. And the board should be included in that selection process before the governing body votes to appoint. So that's usually the Board of Supervisors that would appoint the behavioral health director. We recommend you be involved by being able to review the job description, review applications, participate on interview panels. And usually it's 1 or 2 members, it's just certainly less than a quorum, but that's a way to be involved in that process. Duty number 7 is review and comment on the county's performance outcome data and communicate your findings to the California Behavioral Health Planning Council. That group is a different group than my organization. They are a state council that advises the counties and also advises the state legislature and Department of Healthcare Services. And every year they put together a survey that they ask the boards and commissions to complete is they call it the data notebook, and they usually choose a topic. In recent years, they haven't had performance outcome data as part of that. And we've been advocating that they start really focusing on performance outcomes. And I think we're hopeful in the next 1.5 to 2 years that we'll start seeing really significant change in terms of what's reported in California. It'll be more standardized for performance outcome data. So hopefully this data notebook will reflect that as well. And we have some information on our website related to performance outcome data. This next slide just shows a capture just to show you that all your counties are represented here. And we just look through the reports, like the Mental Health Services Act plans and updates that you've provided on your websites, and the Medi-Cal, EQRO, External Quality Review Organization information. Those reports and plans, they provide outcome data. Often the counties are providing data on the 5 topics toward the top of the slide here. Children and youth, criminal justice, employment, hospitalization, and housing, all related to behavioral health. For instance, with criminal justice, for individuals that had criminal justice involvement before beginning to receive behavioral health services through the agency, we usually see very good numbers in terms of reduction in arrests, reduction in incarceration. Sometimes it's become 0 for those that have been involved with the behavioral health services. And then similar types of data related to hospitalization and housing and employment. With employment, the different counties that are providing integrated vocational and mental health services show good data in terms of percentages. Up to 40% of those people that are receiving employment vocational services will become employed. So it's good to see that type of activity. For children and youth, usually we'll see measures related to attendance at school, reduction in suspensions or expulsions, and information on graduation rates. Also, information is often provided on some of the standardized assessments. And then also sometimes it's wellness reported by parents or caregivers. Teachers will report on behavior in the classroom. Sometimes there's a variety. All right, our last duties here are on number 8. Additional duties can be transferred to your authority through the Board of Supervisors. And then you're also to assess the impact of realignment of services from the state to the county. And we've seen realignment occur in 1991 and in 2011, where it was it was centralized at the state level, and they decided it would be at the community level. So the 59 behavioral health agencies would be responsible, and they put some funding in place for that, which is called realignment funding. Okay, in terms of the Behavioral Health Services Act, we put this as part of the duties, although we've already reviewed the duty, which is assure citizen and professional involvement, but it's especially important to look at it in terms of the Behavioral Health Services Act. And I already showed you there's a list of 29 different stakeholder groups, and that's one of the big heavy lifts of staff, and one of the things that you really should, as board and commission members, be involved in and make sure you're getting presentations on from staff on how they're meeting the requirements. Secondly, review and advise, vote on substantive recommendations. And it's in California law, it will be called a substantive recommendation if your board or commission voted in favor of it during a hearing. So if you have it listed on your agenda as a hearing related to the integrated 3-year plan, then that recommendation must either be implemented in the next 3-year integrated plan, or the staff must explain why they didn't do that. And they must explain that to the Board of Supervisors and to the Department of Healthcare Services. And then you are also, number 3 here is conduct Behavioral Health Services Act public hearings at the close of 30-day public comment periods. So the staff will put together draft integrated plans, and they must allow at least 30 days before the hearing so they can get written comments during that period. And then at the end of the public comment period, you have your meeting. You can open it up and see if there's any additional public comment at the hearing. All right, and then this last slide just talks about some of the areas where we recommend you look when you're reviewing and evaluating. And remember, you're experts in your own experience. So, we want that to inform the system. But these are areas where we recommend taking a look. One is accessibility, looking to see that things are culturally relevant, scaled, integrated between different sectors, and communicated. Communicated, say, on your website or through local media. We want to make sure your services are known. We see sometimes services are even on the sides of a bus or a billboard, or different places where people are, and then also just the signage. When somebody, especially if somebody is having a behavioral health crisis, it's really important to make sure that they can see, or their family, or whoever's taking them to say a crisis stabilization unit. It's very important that the signage is very clear and they know where to go. Number 2, recommended practices would be client and family driven, where peers and peer providers are an essential component. client and family members are treated with dignity and respect and included in decision-making. Program leadership and staff includes people with lived experience and family members. Evidence-based practices, and we have a listing on our website, and trauma-informed practices. Again, we have some information on our website. And then I think it's cut off on this slide. There's something called community-defined evidence practices, which are practices that are known by different community groups or cultural, racial, ethnic, LGBTQ, just different groups that are helpful to their group in terms of behavioral health. And then 3, sustainability, looking to see that things are financially viable. That's something you could ask speakers. You could ask during site visits. Are there barriers to continuing to operate? That's important information to know. And then workforce, the sustainable workforce. And we know that the workforce continues to be a major need throughout California. And then number 4, performance. Okay, so this last slide just lists some of CalBHBC's resources. We have a guide and handbook called Best Practices, and then we also recommend providing all of your members like a member guide that has, some of the things that we covered today, like your duties and the Brown Act, but also things that are more local to you, like your own bylaws, like your membership roster. And then number 2, we have lots and lots of news and issues on our website that we invite you to take a look at. And we put out a newsletter every quarter. And then we have the performance information, which I showed some information on today. And then we have a lot of different resources and trainings. And the trainings themselves include a recording of what I just went through and recordings on other topics. And there's also some just interactive just check your understanding, short modules, like 15 minutes, where you'll read some information like what your duties are and just have a few questions just to check that you understand what they are. And we have modules related to the Behavioral Health Services Act and the duties. Okay, so I'm going to take a look at the chat, and glad to take any last questions. And I'm happy to follow up afterwards as well.
I have a question back on our duties. Are site visits considered a requirement or just a suggested thing to do? And if they're required, can they be substituted by having presentations to the board from sites?
Right. Yeah. For some organizations, just a presentation works fine. And there's no requirement to do site visits. It's just a suggestion.
Thank you.
Okay. Okay, there's a question. Is there an organizational chart or diagram that shows relationship of federal, county, and various boards, including major vendors? No, but you can, I could maybe interact with you by email if you want on that one, but no. Not that I know of.
I would really appreciate that, because I joined the board last summer as an advisor, and I don't mind so much the acronyms, but it's more of context of the relationships. Like, I see the director at the table, I see Cheryl, the chair at the table, and I know there's a executive meeting, and it's like there's I mean, I'm told that it's very complex, all the relationships, but I feel like it's sometimes what that is what's missing. Like there's different trainings and everything, but what's missing is here's how everything is connected. Here's the consumer, and here's like the federal government, here's money coming in, and here's the structure that's there to make sure that the people who are to benefit from these funds and all of this work and effort, here's how they're all related. Like that's something for the last 6 months has been missing for me.
Okay, yeah, let me get back to you with some resources that I think would be helpful, and it probably related to the Behavioral Health Services Act might help since that one is integrated now. So it does speak to all of the different sources that have to come together. Um,
Do you have my email address? You want me to put it in the chat?
I have it. If yeah, I should have it if you registered.
I
Yeah.
did register.
Okay.
All right. All right.
Yeah.
Thank you so much. That would be
Sure.
so awesome if you could get that for me.
Okay, I will do that. And then, does approval of a county's BHSA integrated plan by the state require the review and approval by the advisory board of the procedures used to ensure stakeholder involvement? So the integrated plan itself doesn't need to be approved by the advisory board. But the duty itself that speaks to stakeholder involvement, that's the one place where the word approval is part of your duty. Let's see if I can pull that up real quick. What I missed it.
Slide 9.
Thanks. All right, so that is the one thing that you can approve. It doesn't say you have to approve it annually or anything like that. So it's just kind of open how you would approach approving. And there's so many pieces to it. It's 29 different stakeholder groups. So you could have a formal process of approving if the agency provides you a comprehensive plan on how they're going to approach these 29 stakeholder groups and what tools they're going to use. I see it more usually playing out as a conversation where they'll provide the information and updates, and the board can provide input to help them in terms of that piece. Okay. All right. Well, thank you everybody for all your involvement. Appreciate that you're serving on your board and commission, and don't hesitate to reach out with more questions. I'm glad to connect with you. And thank you to staff also that are on the call today. I appreciate your support. Everybody, take care.